All right. Hello and welcome. I'm Dr. Rachael Clark. I'm an academic advisor and lecturer at Northern Kentucky University in the Department of Psychological Science. I'm here today with Ms. Brittany Schmidt, who is a graduate of our program and who is currently working as a clinical mental health counselor. And we're here today because I'm teaching career planning for psychology majors, and this interview will hopefully help the students in that class make some decisions about career planning, decide if they want to go to graduate school and that sort of thing.
Yeah.
So I will start with Miss Brittany Schmidt. Could you introduce yourself and just tell us what your current position is and what do you do in that position?
Hello, I'm Brittany. I have a BS in psychology from NKU, and I actually also got my MS from NKU. And I am a licensed therapist, so LPCC in Ohio and LPCA in Kentucky. I work for a private practice as one of their clinicians. It's called Waybridge Counseling. We've got a few locations in Cincinnati and Northern Kentucky. And I just started, I actually did my internship with them and then was hired on after I graduated in May. And I'm specializing in gender therapy and neuro counseling. So kind of what drew me to Waybridge was actually to work with their gender program and to work with trans people. So that's a big passion that I have. And I did neuroscience research as an undergrad. And so neuro counseling combines that neuroscience background, understanding the role of the brain and how it can impact counseling. So that's a little bit of a newer specialization that brings the two together, which is nice.
Okay. So I actually am not very familiar with that, but can you tell our class and anyone watching what are the requirements in order to be a therapist? And you have a special kind of niche, a special focus um, for your clients. And can you tell us how did you do that? Do you have to take any special classes, or is it just an interest area and you decide this is going to be my focus?
It's a little bit of both. It's really nice because yeah, you get to pick what you would like to focus on, whether it's anxiety or sex therapy or eating disorders. And once you decide an area that you'd like to focus on, then yeah, you'll specifically do additional trainings. So those are my intended focus areas, but I'm not, completely competent in, not fully competent in both of them because therapy is all about continuing education. So yeah, you get to pick and then you just intentionally do further trainings in your interest area.
So you do need at least a master's degree to be a therapist, and then um, do you take a licensure exam after you graduate before you start working?
Yeah, so there's a governing body called KCREP that's the governing body for counseling programs, basically, because there's a little bit of overlap. Sometimes a social worker will be in a therapist role, like that'll be their title will be therapist. But social workers actually have a different specialization when it comes to being a therapist. We get a lot of training around how you're talking, how you're reflecting back to your client. There's just it's a huge amount of interpersonal training, but it's also you're diving really, really deeply into all of your own insecurities and fears, and you have to just be so aware of everything about yourself to make sure that it's not coloring how you're working with your client. Whereas like a social worker, for example, they'll definitely get some of that conversation training, but they're so much more specialized in all of the resources. This is where you need to go for this education piece, or if you need a women's shelter, whatever it is, they have a lot more experience in a lot of those resources. And there's a lot of mental health professions that overlap a little bit, like nursing. Also, obviously, you have to have an aspect of, being able to talk to patients, but that specialization is medicine. They know way more about medicine than
Mhm.
I would, or a social worker would. So there's overlap definitely, but there's definitely differentiation also. So yes, you have to have a master's degree, and so it depends on the state. The KCREP governing body is attempting to nationalize things. You have to go to a KCREP accredited university to get a master's in clinical mental health counseling. In the state of Ohio, there's an exam that you take right after graduating before you get licensed. But in Kentucky, you don't have to do it until 2 years after you've gotten licensed. So like, yes, there are exams and you're continuing education every year, but it's different statewide. So that's what KCREP is trying to standardize expectations all around. It's a little.
And I think that can be kind of confusing for undergraduates, especially. And a lot of our students probably are sophomores. We're trying to get most students take this class as a sophomore, but recognizing that each state in the United States has different licensing requirements for what is required to be a therapist.
Yeah.
Therapist is a generic word meaning counselor, master's level psychologist, social worker, like you said. It's all different depending on where you live.
Mhm.
So can we go back to your undergraduate preparation now? Because I think probably some students will like to know how to kind of make some choices class-wise in their schedules between now and when they graduate.
Mhm.
So in your undergraduate career, you said you had a BS. So why did you select the BS instead of the BA? And did you have any kind of other supplemental experiences as an undergraduate? I know you probably did some research with professors. What other kinds of things did you do?
I was super involved. So thinking back to freshman year, I think that I would have just been more likely to pick the BS because I was more drawn. This sounds so silly, but I was just more drawn to the science side as opposed to the art side of psychology. And then I actually did research with Dr. Mark Barget for 2 years, and I took biopsychology with him, and oh, now I can't think of the name of it, of course, but I considered minoring in neuroscience. It's not clinical neuropsychology, but maybe it is. Took it a long time ago. But I took virtually everything that he offered. So I actually really enjoyed learning all of the science behind psychology. So I think that's kind of what pulled me in that direction. As far as, actually, what was the other part of what you had asked? I'm sorry.
Oh, yeah, that was a long question. That was really what it was. Did you do anything outside of class in the hopes of maybe standing out a little bit in your grad school applications?
Oh,
Like research?
yes. Yes. So I did research with him for 2.5 years, I think. It's hard to, it was 4.5 or 5 semesters. So it feels like 2.5 years is probably only 2 years, but for 5 semesters, I did research with him. So I went to a couple different research conferences. That was awesome experience because and I was in the honors program, so you also are required to do a capstone project. And so it was a lot of public speaking in front of a lot of people. So it was a good experience that way. I was also involved in a sorority, so that was a lot of networking and also public speaking, and just some not regular, but business professionalism training in a way. And I was a part of the Psi Chi Honor Society and the Golden Key Honor Society. I was actually, I think I was one of the last people that has a minor in honors because the honors program changed it after I graduated, that I don't believe you can get a minor in honors any longer. It's still a thing, like it's still a capstone that you're completing, which year-long project. I was one of the first people to do the honors in psychology project, which is a similar concept of a capstone basically. And Dr. Clark was one of my advisors. And so was Dr. Barge and Dr. Marchinsky. And I got to write a 30-page paper, and I guess it took 28 pages, and present to them like a panel and kind of defend my research question theory. And so that was awesome experience. That was definitely preparatory for grad school, because 10-page paper is nothing in grad school.
No, you can do that in about 10 minutes. Which is your undergraduate experience is pretty interesting, because everything you did as an undergraduate kind of pointed in the direction of future researcher, but yet you became a counselor, which I think is really interesting.
Yeah.
And did you not also do a study abroad program?
Yes, I did.
Mhm.
Lovely. Dr. Clark took me to Ireland,
Yeah.
and it was magical. It was really awesome. We studied, it was research around with kids. So we got to go visit kids in different school environments. And it was, I don't know, it was a very, it was a wonderful experience. I have 2 tattoos that have to do with Ireland. It was wonderful.
Well, it sounds like as an undergraduate, you took advantage of a lot of opportunities outside the classroom that informed who you are today, what kind of a therapist you wanted to be. And I think probably some students might be wondering about the application process for graduate school. So did you have to take the graduate record exam, and what did you have to do to get into graduate school?
So yes, yeah, I did have to take the GRE. So like you said, my path was very much leading towards research, and I had actually intended on getting my PhD in clinical neuropsychology. And so my last semester at NKU, I spent time applying to the schools and programs that I wanted to go to. And so I went, one of them was actually Vanderbilt. So one of the things that I did was I scheduled an interview and went and spoke with the research assistants in the lab that I wanted to work in. And so that can be helpful, get a feel of the campus. I know it's kind of weird right now with COVID happening, things are a little bit less flexible. So that would probably be hard. But so exploring things was really helpful in that way. But the reason I did not was a trauma. My ex-boyfriend died. And so I just was in a different place, and it just didn't work out the way that I had planned, which sometimes happens in life. So that was actually why I ended up not going to get my PhD. And then I'd always been interested in counseling. The reason I wanted to get a PhD in clinical neuropsychology is because I like research. So I wanted to do research for a little while. And then I wanted to do counseling for a little while. And then I liked the idea of being a professor and setting my own schedule. And so I had all of the next 30 years, whatever laid out, which just doesn't work sometimes. And so I spent 5 years between graduate or undergrad and graduate, because I tried to find something with my psychology degree that I could be passionate about. And the whole time I was like, I think I'm gonna be a therapist. But I tried different career paths, and yeah, I just wasn't fulfilled by any of that. And so it was easier for me to apply for grad school because I already went to NKU. And I did take the GRE that last semester before I graduated, so I already had that score. I actually took it again the next year to see if I could get a better one. I got the exact same score. So it was a lot of counseling programs do require a GRE, but not all of them. And yeah, like I said, it definitely was a little bit. I think the application fee was also waived just because I was an alumni. So it did make it easier to go to the same school that I got my BS at. So
Yeah.
a little bit simpler.
Yes, I think the GRE can be a little terrifying to some people. So there are some benefits to sticking at the same school for not having to pay an application fee. We also now have a bridge program for the industrial organizational psychology program.
Yeah.
And that's, you can apply as an undergraduate to that. And if you get in, they waive the GRE requirement
Oh,
if
that's
you end up
lovely.
getting your master's there.
That's lovely.
Yeah. So let me ask from your perspective, what do you think, what would you say the difference is between psychology and counseling? Because I'm not sure if students understand that psychology and counseling are two different disciplines. Um, we have an undergraduate program in counseling. It's called Human Services and Addictions now. Um, but what's the difference from your perspective? And do you feel like you were prepared for grad school with a psychology degree?
I do feel like it helped a lot. Psychology can branch in a lot of different directions. And so I think that's a key difference is you can take psychology in a lot of different directions, whereas counseling is a little bit more of a refined path. Um, it did definitely help. I would also say psychology at its core is from from my perspective, as you said,
Mhm.
uh, the history of it, the history of the development of it, and how previous scientists attempted to combine what we knew about biology and chemistry and physiology with understanding human nature. So I think psychology is a that that core of combining science with people, and the backbone of counseling is a lot more about people. Um, Now there's a lot of evidence-based practices in counseling. A lot of people are familiar with CBT, which is cognitive behavioral therapy, and that's one of the most evidence-based types of counseling. There's also a lot of research around, though, that it's not really about the theory that you use so much as the therapeutic relationship. Um, Me specifically using humanistic theory on you is unlikely to have a better result if we don't have a strong therapeutic rapport. So, I guess I would say the biggest difference is psychology is, in my head, science, and counseling is people.
Mm, okay.
But
Yeah.
at least then they can work together. Yeah.
Yeah, I think I get that. And from my perspective, the only thing I would add to that, and this isn't about me at all, but I think that psychology tends to be a little bit individually focused, and counselors tend to take into consideration context a little bit more in
Mhm.
terms of the presenting problem.
Yeah.
Um, um,
Yeah. I wouldn't disagree with that. You can have a client come to you with, uh, 10 presenting problems, and it's a matter of unraveling and finding the core of what's happening.
mhm, mhm. Well, I think I've asked all the questions that I wanted to. I'd like to open it up to our student. If you have any questions for Brittany about anything having to do with grad school, being a therapist, anything you like.
I just wanted to thank you for taking the time out of your day to talk to us. It means a lot. And I was gonna ask you actually if you went to or if you wanted to go get your doctorate degree, but you kind of already answered that question. Have you ever considered going back and getting your doctorate?
I have, but definitely not anytime soon because I finished my master's degree in May of this year. And so it's been a very interesting adventure becoming a therapist in the middle of a pandemic. Um, so yeah, like it's a thought, but not in the near future. Not for a minute.
And Krista, so you know, I just got my PhD 4 years ago, and I'm a lot older than Brittany. But yeah, I practiced for about 15 years with a master's degree in clinical psychology and started teaching at NKU and just got really excited about all the research that was going on in our department. And I just needed a refresher. I had not done research since my master's program. I'd been a clinician since then. And it's always something you can do later. It
Yeah,
doesn't matter how old you are.
yeah, definitely.
It's great to know. Yeah, because that's one of my crossroads right now. I don't know if I want to go for my master's or just go ahead and go for the doctorate. So thank you.
Hmm.
If you are sure about the doctorate, it can potentially be a faster process, like more streamlined to just immediately do it. But yeah, you can definitely separate it if
Yeah.
that works out better.
Well, Brittany, if you can hold on for a second, I'm going to stop our recording. But on the record, I do want to also say thank you very much for your time and talking to us this morning about your career path. It was very helpful, and I think the students are really going to get a lot out of it.
I hope so.